fellow Petra has a seat for you.
Do I have a seat?
You have a seat. Commissioner Johnson's here. Good. Senator Turner, good. Stand right here. Sharif over here.
Sure.
I was saying here. We'll have Mary Gay too. Test, test, 1, 2, 3. Testing, testing, 1, 2, 3. Mary Gay, if you could come up at this time.
Good morning, everyone. Welcome to the Rescue Mission of Trenton. For the past 40 years, I have had the honor of working at the Rescue Mission of Trenton, where we work each and every day to rebuild lives and set a positive outlook for the great city of Trenton, our community. When I came to Trenton 40 years ago, it was to take a job at the Rescue Mission of Trenton. I wanted to be part of an organization that changed lives, gave support to others, and those struggling with the most difficulties of life, primarily homelessness and substance use. As the CEO of the mission, I can proudly state that everyone who comes here wakes up every morning, obviously if they came here they woke up, came ready to go to work, and really were focused on saving lives. In 2016, 116 people died every day from a substance-related problem, more often than not an opiate. These overdoses must come to an end. Several of our guests today just attended the funeral of a young man who died from an opiate overdose. we must not forget that this problem touches every community, every life, and everyone in it. It knows no boundaries. When I look outside the rescue mission, I do not know where this day will lead us or who may enter asking for help. But I do know this. With the proper access to quality treatment, to housing, to employment, and social support services, we can, and with the great leadership of our governor, we will win this war. Governor Murphy's investment to combat an opiate epidemic that has ravaged our community is both recognized and sincerely appreciated. I have seen thousands of lives that have been devastated because of drugs, and particularly opiates. But after today, I am a bit more optimistic that we are on the path to change. I would now like to introduce our governor, Phil Murphy. Thank you.
Thank you so much. My honor to be here, believe me. Thank you very much, Mary Gay. More on you in a moment, but thank you very much for your kind words. Good morning, everyone. Thank you all for joining us here in Trenton. The budget that we unveiled just 3 weeks ago proposes a $100 million all-in effort against our opioid epidemic, which, as Mary Gay said, has become all too personal for too many in this state. We are here today to put this proposed investment into greater detail. How we will expand access to treatment, attack underlying social risk factors, and ensure better data for us to focus our overall efforts. It is a great honor also to be joined by such an illustrious group. We have our county executive, dear friend Brian Hughes, who leads Mercer County, with us. Trenton Mayor, another dear friend, Eric Jackson, is in the house. A rockin' legislative district led by Senator Shirley Turner, who we'll hear from in a minute, and her assembly colleagues, Reed Gashora and Verlina Reynolds Jackson, who's new to the assembly, and great to have you both with us. And I know they share our commitment to the fight against opioid abuse and misuse. I also want to welcome to my left Commissioner Dr. Sharif El-Nahal, who I had the honor of swearing in yesterday. If there's any social media footage of that, you realize it took us about 15 minutes for me to find the oath, but we did get it done. And Acting Commissioner of Human Services, Carol Johnson's with us as well. Carol, honored. Thank you again, Mary Gay, for your introduction and the opportunity to tour the Rescue Mission of Trenton. I've wanted to do this for months, and it was an honor to get here finally on this beautiful spring morning. More importantly, thank you for the tremendous work that you do here, your son Barrett, who was very good to take me around, your colleagues to help residents caught in the grip of our opioid epidemic. I would recommend to anybody who's here today, whether they be in the press or concerned citizens, a tour of this great facility and meeting some of the folks whose lives are being changed is well worth it. The programs here are vital to breaking that hold that too many are under and freeing residents from the scourge of addiction. But we also must recognize that as good as they are, the Rescue Mission of Trenton can't win this alone. They need partners in state government alongside them, providing vital resources and information. And they need a government that understands that recovery doesn't end when someone walks out of treatment and back into society. Last year, I visited, among other organizations like this, both Integrity House in Newark and in Patterson, the Patterson Counseling Center. I had the opportunity to speak not only with individuals seeking help, but also the counselors and doctors who are committing themselves to defeating this epidemic that is ravaging communities. And we cannot forget ever that opioids were destroying lives in our urban neighborhoods long before this epidemic made headlines. I made that point in our budget address, and I repeat it today. Let us never forget that. This isn't someone else's problem. This is our problem. It's a New Jersey problem. and we all must come together to rebuild lives and rebuild communities. The fight against abuse and addiction, whether it be opioids or other drugs, requires deep interaction among communities and with and also among our administration. We will do it the right way by putting investments where they will do the most good, with collaborative approaches to maximize the impact of every dollar we invest, and treating not just the disease of addiction, but helping individuals get back on their feet. If we are to get ahead of this problem, we must remove the stigma. We will not treat addicts like criminals. We will treat them as our brothers and sisters who need an outstretched hand. The most important aspect of our fight, naturally, is in expanding and improving access to the community-based outpatient programs that individuals battling addictions need to ensure consistent and timely access to treatment. Additionally, we know that coordinated approaches that bring together treatment, including access to medication-assisted treatment, and peer-based recovery coaching can be highly effective. Our budget would provide $56 million to do what I just said, to backstop these efforts. We similarly can't ignore the importance of how we help individuals in recovery once they are on a path to recovery and sobriety. We know that addiction is a hole that even once someone climbs out, they can very easily fall back in unless they have a strong support system. If we only treat the individual but fail to treat underlying factors that can lead to relapse, such as homelessness and unemployment, we cannot defeat this epidemic. Our budget would provide $31 million to address these risk factors, these societal factors. We would provide funding for supportive housing to ensure individuals in recovery have a safe place to live, and for job training and workforce development so they can get back on their own feet for the long term. We want these residents to be a part of our economic revitalization. It's good for them, it's good for all of us. And we know that to be successful, we must ensure that our state's addictions system is prepared and equipped to deal with this fight. We must be guided by facts and data that not only tracks where resources are most needed, but also which are having the most and greatest effects. To ensure that we are taking this approach, we would invest $13 million to build out the modern data-driven infrastructure we need. Addictions providers need infrastructure support for data and technology and workforce development so that they're modernized and equipped to work with patients, not just on the short road, but on the long road to recovery. We know that many of our addictions providers are not on electronic health records, a basic tenet of modern health infrastructure, leaving a lot of providers decades behind. Also, quite simply, we cannot just blindly throw money at the opioid problem. We must be strategic, and we must use integrated data for population health research and programmatic evaluation. Strengthening this frontline infrastructure won't just give us a baseline, but also help ensure continuous improvement. We must use this data as the basis for driving comprehensive approaches to treatment. And I have to say, as an aside, if this were a baseball team, you are seeing us evolve from making decisions based on our gut feeling to Moneyball. Let's figure out exactly what is working, what is not working in real time. Let's get the robust databases in this arena that we have in so many other health arenas and make sure that we're making informed decisions based on fact and science. With this data, we will not forget our mission to ensure, and this is equally important, to ensure that an individual does not just become a statistic. At every center I have visited, including today, I have met amazing people, talented and educated people, people who want nothing more than to prove to themselves, their families, and to society that they are better than their past. They deserve this opportunity to escape the grip of addiction and get back on the path to a life with value. And we must ensure they have it. For those of us in government, our work will span departments and agencies, whether it be in the collection and analysis of data, in ensuring the access to health care, or in the workforce and housing issues I just mentioned. At my inauguration, I committed to continuing the battle against the opioid epidemic. I am proud that our budget would live up to this commitment and allow us to use not just some, but every tool at our disposal. It is with this battle in mind, in fact, that we move to expand our medical marijuana program to help reduce the potential for patients to turn to opioids. I mentioned this not only when we announced our audit of the medical marijuana program, but also when we announced the results last week, that we believe medical marijuana can be a major weapon in the fight against opioid addiction, both as an alternative to opioids. You know, we all see this too often. We've seen it with a family member of late where the opioids are dispensed like M&Ms. There are alternatives. The medical marijuana alternative is a real alternative. Our medical marijuana system has been gummed up for 8 years. We are going to open that up. It is not just, believe me, as an alternative to opioid addiction. There's a whole lot of other reasons why this needs to be opened up. And you saw probably last week, if you were with us, that we extended the list of maladies that will now allow folks access to the program. We've destigmatized the role and the engagement of physicians in this process. We're going to expand the amount of places where folks can get it and make it easier and cheaper to register. But it is clearly one of the major reasons to do this. Again, not the only one, is it is an alternative to opioid addiction, or alternative to opioids that lead to addiction. It is also, for those blessed ones among us who are recovering, it can also be a major weapon in the recovery process. And I had pleaded, and I think Dr. Elnahal, who now has the ability to add or delete maladies, I suspect more adding than deleting, that are eligible for medical marijuana, I want to make sure, and I believe he does as well, that opioid recovery is a valid challenge, health challenge, that allows one access on the way out of addiction to the medical marijuana program. But we are not going to wait, and as important as this statement is in this budget, we're not going to wait for our budget to take action. We're already undertaking additional efforts to combat this epidemic. NJ Family Care is working to implement a Medicaid waiver, which will allow the program to provide a full continuum of substance abuse disorder treatment services to New Jersey's Medicaid enrollees. Further, in February, just over a month ago, Attorney General Gurbir Grewal created the Office of the New Jersey Coordinator of Addiction Response and Enforcement Strategies, shockingly an acronym, NJ Cares. This new office, funded through federal grants, and we welcome the additional federal money, I should say, is overseeing addiction fighting efforts across the Department of Public Law and Public Safety, and creating partnerships across other agencies and groups. It includes new statewide opioid response teams, greater information sharing, and importantly, enhancement to the NJ prescription monitoring program, so we can do more to curb opioid addiction at the place where too many people found entry. Read my comment about dispensing like M&Ms. The treatment centers across our state, which have been on the front lines, whether it be the Rescue Mission of Trenton right here, and again, God bless you for the work that you and your team do, Mary Gay, whether it's in here or Integrity House in Newark or the Patterson Counseling Center or elsewhere, they need to know that we will not leave them on their own. Those seeking to free themselves from addiction need to know that we will not forget them, and that we will be there to help break the stigma that has all too often been attached to addiction. These are the commitments we must make, and working with our legislative partners, I hope we will. Thank you all so much again for being here this morning. It is now my pleasure to introduce our Commissioner of Health, Dr. Sharif Elnahal. Sharif?
Thank you, Governor Murphy, Senator Turner, Assemblywoman Jackson, Assemblyman Gusciora, Mr. County Executive, Mr. Mayor, Commissioner Johnson, Rescue Mission CEO Mary Gay Abbott. Thank you for hosting us this morning, and good morning. Governor Murphy, thank you for your leadership on this urgent public health issue and for prioritizing the opioid epidemic by making an additional $100 million available in your first budget to prevent and treat it. During my medical training, I remember seeing a woman with head and neck cancer that had returned after it was initially treated years prior. She had just finished radiation treatment for a second time. Before this round of treatment, she feared not only from the pain of her cancer, but from the pain that inevitably came from the treatment itself. But on this visit, she ended up expressing her gratitude that we had offered her an effective alternative medication that helped with her pain, without relying solely on opioids. She not only felt better, she had avoided becoming dependent on this highly addictive drug like she had the first time around. Ladies and gentlemen, the most important news about today's announcement is that because of the governor's investment of $100 million into fighting the opioid crisis, we will be able to do this and much more for folks across New Jersey. The funding is not about any single program or any particular department. Rather, we are taking an organized, coordinated, data-driven, multi-agency approach to eradicate an epidemic that took the lives of more than 2,200 victims in 2016. These funds will help us expand access to community-based outpatient treatment, as the governor mentioned, including medication-assisted treatment, peer recovery support, and supportive housing. The funds will also enhance our data infrastructure, which will help us evaluate the efficacy of our efforts in real time and identify hotspots of the epidemic that will inform a targeted public health approach. Indeed, Governor Murphy has directed an evidence-based strategy that puts the tools of public health to work, an approach that maps the journey of people in New Jersey from their initial exposure to opioids all the way through to addiction, incarceration, overdose, and death. At each stage of that journey, there are unique efforts that will reduce the number of people who pass through the gates into the next stage, and we will consider all strategies that are effective. Importantly, we will use integrated data across the state government that will allow us to identify, expand, and reinvest in effective programs. As an example, the department will look to best practices that provide a playbook for what we did for my patient, like the Alternatives to Opioids program at St. Joseph's Medical Center in Patterson. The governor has also directed us to expand and improve the medical marijuana program, as he mentioned, another effective tool in clinicians' belt for treating chronic pain, reducing the need to expose folks to that initial opioid prescription. In addition, and very importantly, we are working toward a single license that allows for primary care, mental health, and addiction treatment to occur under the same roof. That will increase access to these services tremendously and offer a multidisciplinary, patient-centered approach. The department has already released a guidance document in December of last year on integrated care, and our Integrated Health Advisory Panel is eager to support a system of integrated care in New Jersey. We are also going to promote medication-assisted treatment for addiction in medical education. As an example, Rutgers is currently the only medical school in the nation to ensure that all of its students not only receive training, but certification from the federal government in this important area before they graduate. We want to see that investment across the state. Finally, the department is launching an awareness campaign for pregnant women to get addiction treatment and reduce the risk of neonatal abstinence syndrome. And if you've ever seen that in a baby, as I have, it's quite a hard thing to watch. But we still have much work ahead of us, getting clearer guidelines and opioid prescription practices to the front lines of healthcare, expanding the use of prescription drug monitoring program to outpatient clinics, and building better structures for interoperability and data sharing between care settings, such as this very effective one right here, will enable us to make more progress moving forward. The governor's budget will go a long way in helping us tackle these challenges and much more. Thank you, and it's my pleasure to introduce Commissioner Johnson.
Good morning, everyone. Thank you, Governor Murphy, and thank you, Mary Gay, for being such a tremendous fighter for our community. I so look forward to working with you in the years ahead. I'm delighted to join with the governor and my colleagues from across the government in today's announcement of $100 million in funding in the governor's budget to combat the opioid epidemic. This epidemic has taken a heartbreaking toll on too many New Jersey families. I'm proud to join with the governor in this all-hands-on-deck effort to turn the tide of this crisis. As some of you know, I had the opportunity to work in the Obama administration on the implementation of the Affordable Care Act, where we made mental health and substance use disorder treatment essential health benefits that have to be covered by individual health insurance policies. But we know that making insurance benefits work for individuals also requires resources and capacity on the ground. And that's what today's announcement is about. The governor's budget's investments in technology and workforce development will support a strong substance use disorder treatment system in this state. And we are taking important steps on direct treatment services. First, as the governor mentioned, we're implementing our Medicaid substance use disorder waiver, which will enable New Jersey to offer a more complete Medicaid service package to assist those battling opioid and substance use disorders. The Medicaid waiver provides several solutions to increase coverage of both short and long-term residential treatment services and medication-assisted treatment for Medicaid enrollees. Second, the budget invests in prevention, treatment, and recovery strategies that include a strong focus on improving access to community-based outpatient treatment, including medication-assisted treatment. It's important that we have a robust continuum in New Jersey to help people get the treatment they need. A continuum of services means the combination of the budget's investment in expanding community-based treatment and our Medicaid waiver expanding access to residential treatment. Together, they will help put us on the right path. The funding announced today also recognizes what public health experts have long said about the importance of helping people sustain recovery by focusing on their social as well as their clinical needs. So this budget takes seriously the charge of focusing on employment and housing, two of the key supports individuals in recovery need. But the governor's budget doesn't just focus on social determinants of health for those in recovery. By expanding the earned income tax credit, setting a path for making community college tuition free for all, rebuilding our transportation system, and much more, the governor's budget is a roadmap for recognizing that economic health and access to services, transportation, and job opportunities supports the health and well-being of all of our residents. We look forward to working together with stakeholders and the legislature to implement the governor's budget and this all-hands-on-deck approach to combating this epidemic. Thank you.
So I'm back up here for two reasons. One is I think I was thrown off by how long it took me to find Sharif's oath. I actually, for those of you wondering if I'm losing my marbles, as many of my teammates are, I actually also swore Carolyn yesterday with her husband and Jim and her parents right there. So there are many witnesses to that, Carol, and I believe it was congratulations. I believe I was thrown off by how easy it was to find your oath. I don't think there's a better, as I said, I don't think there's a better three-headed legislative team in this state, and I don't think there's a better senator. So it's my great honor to be in her district. I'm humbled to introduce Senator Shirley Turner.
Thank you, Governor, and thank you so much, Governor, for leaving West State Street and coming to Carroll Street, which is the heart and soul of the 15th Legislative District.
You won't have to ask twice.
This is truly an exciting day. This is a day that we have waited so long for, someone who is going to put their money where their mouth is. And we applaud you, Governor, for that. Many of us left a viewing this morning. This program will not help him, but it could very well help so many other people. And this is truly an epidemic. And we have seen it right here in Mercer County because the person whose viewing we attended this morning is a Mercer County resident. And when I went to the viewing, I saw his grandmother, and one thing she said to me was, we're blessed, we have a support system. And this program that the governor and his staff have outlined is going to be a holistic approach. It's It's going to provide many people who don't have support systems and infrastructure. It's going to provide that to them. And this is where we need the most help for the least, the last, and the lost. And this is where we find most of those people here at the Rescue Mission. And if you want to change lives, save lives, the place to be is here. So thank you again, Governor, for being here today. And I know we're going to see you many more times in the community where the need is greatest. Thank you.
Thank you, Senator. Thank you. I do want to add to that very briefly and say not only do we have a great legislative team here, we've got a great county executive, and Mercer County in so many respects sets the bar for county government. And by the way, the state could learn a lot from counties like Mercer, so Mr. County Executive. And Mayor Jackson and I have been dear friends for many years. I'm sorry to see you pass the baton, but we've bonded over the fact, and it'll be with your successor, whoever that may be, that this is the capital city, and that the government can't just behave like a spaceship that somehow landed here. It has to be deeply integrated in the community. The mayor needs a partner, and that partner, let there be no doubt, has to be the governor. So I'm honored to be here today, and honored to say I'm on my side. I want to raise my hand to make this as great a community as it can be. With that, we get time for a couple of questions, please.
Governor, your predecessor, Governor Chris Christie, allocated $200 million towards opioid programs. They told you about how he went about doing that. But so what are providers supposed to do that's staffed up based on the Christie-era programs and now don't have a designated line item? For example, you mentioned the Recovery Coaches program. Last year, there was a designated $16.6 million for that. This year, it's very vague and amorphous about how these monies will actually be allocated. And so your budget has $1 million, and no amount of coordination, I would think, could make up for the loss of that other $100 million that was sprinkled throughout the budget. So when will people actually find out which programs are being cut and which are being continued?
I think if you're a television production firm, you're going to be disappointed. Let me start with that, because that's not the way we're going to go. And I think of the $200 million, it was mid-cycle in the budget. It was unused funds. There's a more elegant word for that. And I think at the end of the day, only 90 million of that, as I recall, went out the door. The bigger point for us is we've taken a couple of months across all of our departments to do a deep dive based on fact, based on experience. It must be said that if you look at the group I'm with today, you've got both deep New Jersey experience and you've got deep national experience. And so we have studied this across departments, and we're putting forward a program that we think has the best chance to crack the back of this epidemic. So you heard the numbers. It's 100 million, 56 million to largely distributed engagement in organizations like this, outpatient. 31 million in the societal bucket to strengthen things like cracking the back of homelessness and improving workforce development, et cetera. And lastly, an infrastructure and database that will allow us to not only come to the 21st century in opioid addiction programs, but also iterate. Sharif and I were saying, listen, we're putting this forward. This is not a museum piece. We're not putting this out here and walking away for a couple of years and hope like heck it works. Part of the reason why we want the data investment is to make sure we're real time figuring out what's working and not working. So I'm going to talk less about what was done, other than we're not going to be on television, but more about what we believe with all our heart is the right program to solve the back of this, and that's what you heard today. Matt. No, we did. Come on down, folks, and any other color you want to put into this. We're already implementing this.
So, I guess maybe then more specifically, when do we find out exactly kind of beyond the broad strokes of $100 million, how this will be allocated?
I think it's help me out, Sharif. I mean, I think that's
absolutely, Governor. Yeah, so the specific programs that the $100 million will go into in those broad buckets, we're going to collaborate in a multi-agency way to figure that out. I will tell you that in this fiscal year's budget, the governor has asked us to continue those programs where you already have contracts executed and where people are already benefiting. And that includes programs in neonatal abstinence syndrome, prevention of that. It includes peer recovery support programs. The specific programs going forward are going to be forthcoming.
Any timeline on?
Well, it's by the budget, right? So it's the next, we have to get this all baked by June 30th. Others, please. Dustin.
Are there any programs related to Dr. Elmore as well?
Not acting Commissioner Johnson.
Are there any programs that were used in the past where we were not $20 million that Kevin Christie announced last year that you found that weren't working, do away with, reduce funding separately? Mid-state correctional facility is converted into a treatment center. Is that going to continue?
So on the first one, I'll let Sharif or Carol answer the second. The first one, and this is not personal. You guys are going to overstate this. I was at a National Governors Association meeting a few weeks ago. 60-year-old guys talking to young kids about addiction and the perils of addiction does not work. So the one, I could tell you, the one sort of most visible piece of this is we're not going to be doing any television programs with yours truly, or frankly at this point with anybody. I did hear some pretty cool ideas, social media and otherwise, where there's peer-to-peer opportunities. That's not per se baked in this budget. That's something potentially that I'd be open-minded to, but there won't be anything with, because it it isn't effective. On the mid-state, you want to, either one of you?
Sure, and then if you want to supplement, absolutely. So just one thing to mention is that a lot of the money that the Christie administration had obligated for this problem never actually made it to the agencies and never therefore made it to programs into the community. That's a major point that I think people need to understand. For example, there was a big case management a program that was supposed to be implemented, over $30 million, never was actually executed. So we're not going to be pursuing that for that reason. We just don't know if it's effective. However, the programs like the one you mentioned, where we're going to provide peer recovery support in institutions, correctional facilities, that is going to continue. And we're going to be picking program by program. Whatever we saw was effective that was actually executed in this past year, we're going to take a hard look at that and see if we can continue it.
Cheryl, you want to?
Sure. I will just add that we also are doing a baseline assessment of what we're doing in our Medicaid waiver to make sure that where there are opportunities to partner with the federal government to increase resources and capacity, we're doing that. So there are peer support and case management components of our waiver, so we're making sure that we're utilizing those as effectively as possible and getting the federal match on those resources.
May I just say one other thing on this? Just because it was done in the last administration doesn't mean that it's not good enough for this administration. So if something's working, we're all in, period, full stop. Please. I cannot is the honest answer, but maybe you can. I think it's too early to tell. No, so good question. The comments I made about medical are separate from this investment. And we had put in the budget a total of $80 million of revenues in the total budget, not up against this program. We're going to fund this, God willing, assuming we get resolution with legislative leadership in the legislature. That budget includes $60 million from adult use marijuana and $20 million from medical marijuana. The $20 million, whether it's licenses, fees, or whatever, is a statement that we're unleashing on opening up that program. It's not dependent on this, though. Good question. Michael?
Governor, just to clarify, Governor Christie announced a $200 million initiative to be cobbled together from funds in the government that hadn't been spent.
That's my understanding as well, yes.
You say that only $90 million of that actually made it out the door.
I believe that is correct.
And that you're proposing $100 million within the budget as a new initiative.
Correct. Everything you just said, I agree with. Maybe one more, please.
Governor, may I have the same question on the truck travel ban? I know New Jersey has joined the opposition to that
Yeah. Well, it's a long list of things that we don't agree with this administration on, so we don't have enough time today to get into it. But it's, from the moment this came down, and I was a candidate at the time, I was at Newark Liberty Airport that day or the day after, meeting with pro bono lawyers, calling this out. It is what it. Listen, this guy missed a meeting on the history of our country. So he himself is the product of German immigrants. I'm the product of Irish immigrants. We are the world's ultimate immigrant nation. We wear that as a badge of honor. I think there are 330 million of us. I believe this is about right. And I believe about 5 million are Native Americans, which means a lot of the other folks got here for different places, some against their will, let us never forget that, for different reasons at different times. So having a sensible, open, but secure immigration system, and its security, we all understand that, but there are ways to do this and there are ways not to do this. And you can assume that when you ban X number of countries that are, in this case, predominantly Muslim countries, that's a statement that our president is making, and that is not the statement that America has traditionally made. When in doubt, I go back and I read the poem at the base of the Statue of Liberty written by Emma Lazarus in the 1880s. I think with that, we're going to say goodbye. Michael, yes? Is this about baseball or something, I hope? Or okay, politics. Excuse me. This Mary Gabe, I have to say one thing. That is the last payphone in New Jersey, I believe. There's actually two of them. Can't make that up.
Are you appointing Senator Bob Gordon to the continue?
I've seen these reports. When we're ready to make announcements, I promise you we'll make them, but we're not making any personnel announcements today. But thank you for asking. And thank you all so much, and Mary A, thank you, and Barrett and the whole team for having us today.